I'll tell you something. If you ask any of the immigrant and refugees, their first priority are their children. They just want a better life for their children.
I went through the Boat People experience in 1975, and we risked our lives. It was a very scary experience, but we did it because of the future of our children.
Some of the challenges that Somali families face relate to what they experienced prior to coming to the United States. Somalia has been, it's the longest standing anarchy in the world. They've been without government for almost 20 years, which means that many of these kids have grown up exposed to extreme violence and fighting in their communities. They may never have had any formal education. They may not have had access to some of the basic scaffolding of childhood, like school and healthcare and enough food. So when they come to the United States, they're bringing with them the burdens of that kind of trauma and adversity that they've experienced.
There was one student, when he first joined our program, he couldn't even read and write. He was almost illiterate. He had just migrated from Liberia to Philadelphia. He was in the 8th grade, supposedly. Because of the war, he had missed school for about 15 years. But when we went to our teacher training program, in which we taught the teachers, up to now we have taught about 250 teachers how to understand the characteristic of these children that came from the war zone. With that knowledge, the teacher was able to go back to the classroom and have a different attitude, a very assurance of how to deal with a student like that from Africa. As a result, the child excels so much at the point that the teacher now refers to that child as one of his best students.
There are many dimensions to how one integrates large numbers of newly arrived immigrants. One of the ways is predominantly local community-based, and that means school systems, community agencies, volunteer groups, frequently immigrant groups themselves, come together to figure out what is needed to make the transition from being an outsider to being an insider, from being a person who needs help to being a helper.
Caring Across Communities is a national initiative that's funded by the Robert Wood Johnson Foundation, which brings together 15 grantees from around the country who are providing school-connected mental health services to vulnerable families and children from, particularly with an emphasis on those from other countries, so immigrant and refugee families. And we do so, and they do so, through partnerships, through key collaborations between schools, community mental health service agencies, and through immigrant and refugee organizations, really working together to come up with solutions for how to connect effectively with families and children.
Project Shifa is a school-based mental health program serving Somali adolescents in the Boston Public Schools. Somali adolescents typically are all refugees who've come here from Somalia, and our goal is to really develop a program that works with this particular community and then pull out principles of care that we learn in the process so that we can do the same type of program tailored to different ethnic groups. One of the major accomplishments of our program is that we're reaching families with mental health services. Before we began, 92% of the Somali kids who needed mental health services weren't getting them. Since we've started, 100% of the kids referred for mental health services have engaged in our program. And more recently, families have been coming to us and asking for services on their own instead of having to wait for a referral or a problem to emerge.
The schools and the community that we're working in is a very high crime community beset by the difficulties that many of the newcomer communities face in this country. High gang involvement, very high poverty, very high crime, and as a result our young people are experiencing greater and greater levels of community violence even in the short time that they've been here. The name of our program is Bienestar. Bienestar is a Spanish word that means well-being. Program focuses on providing services to immigrant high school students mostly, who as a result of either pre-immigration, immigration, or since arrival experience are struggling with symptoms of child traumatic stress. The program works in a local high school in Los Angeles to provide a secondary level intervention, cognitive behavioral intervention for trauma in schools, and partners with a local immigrant assessment center to help identify students in need.
We've served 200 kids during the last year, 200 children and adolescents. We're fully working in both schools, so we have school-based social workers in both schools who are being used for mental health services. The teachers are using them for consultation. Behavioral referrals to the offices are down, which is always a good sign. And our kids are actively seeking the services that we're providing, and I feel like there is this sense within the youth population that they're finding their place within a Chicago public school, which is often very challenging. I think that we are serving groups of kids from our own expertise that the city of Chicago and the Chicago public schools would have a harder time serving. So I think that partnership alone has made the investment worthwhile. I think that we have youth who are starting to understand what is expected of them in the classroom more quickly. And again, I think that's a very worthwhile investment. And I think we're beginning to understand what the approach is in terms of working in schools as an outsider that will very quickly build bridges between parent communities and youth communities and the school staff and the agency. So I think, yes, the investment has been absolutely worth it.
Taman is located in San Jose, and San Jose is the city where we have the largest population of Vietnamese immigrants outside of Vietnam. As a city, this is the largest. What we've seen is a rising incidence of suicide among Asian girls. And when we mine the data, suicide attempts, the main reason is family conflicts, that they don't feel supported. So we bring them in to talk. We bring the parents in to talk. We also have parenting classes. And we also have a radio program where we talk about these issues. And we expose the difficulties so that the parents do not think that they're alone. They think that this is a problem that a lot of us are going through. And we are too proud to talk about it in public. But actually, a lot of us are going through the same issues. People don't know what is mental health, and they think that it's a sin, it's a karma, you hide it, it's just something that you have to live with, but they don't know that there are services. We've been successful because we've raised awareness about the conflict within the families, and that we have created space for dialogue among the generations. And so those issues are not hidden anymore, but they're out in the open, and we can share experiences.